at the 75th annual ASRM conference. This is 75 years. I can't believe it's been that many in the field of infertility. And I'm here with my business partner, Dr. Santiago Munne. He developed a first technique to genetically test an embryo. This was a game changer in the field for embryo selection. And the terminology that we've been using in the field has changed throughout the years. We used to call it PGS and PGD. We now call it PGT. So first we're going to let Santi talk to us about what is PGT. So let's define that for everyone.
Yeah, so PGT is a technique by which we sample the embryos. We take a few cells and then we analyze if they have chromosome abnormalities, which is the major reason for embryos not implanting. Chromosome abnormalities are very common in embryos. It goes from 40% in young patients to up to 80% in patients over 40.
Wow.
And this is the major cause for which these people may struggle with infertility. These abnormal embryos either will not implant, they will miscarry, and in some instances reach term with an affected baby. So what we want to do in PGT is to select those embryos that are genetically normal, chromosomally normal, because those are the ones that are going to give you a better potential for a healthy baby.
Got it. Now, this is something that I see on the Facebook message boards all the time where it's still controversial. You know, people say, I'm pro PGT or don't do it. Some people feel like they did it and shouldn't have. Some people feel like they've had embryos discarded that shouldn't have been discarded. Why is there so much controversy around it?
Well, there is now, we just published the biggest randomized trial using the newest techniques, and it shows the same that you could see in the SART database. SART database is a database in which all the centers in the US produce their data. You can go to any clinic and you see the results of that clinic, and basically shows the same, that from 35 and above, PGT does help improve pregnancy rates, but it doesn't below 35. As I said, this is a real-world study with 30 clinics involved, and it's showing the same thing as in the SART database. Now, there are other studies done in good clinics in patients below 35, in which also it shows that it's improving results. So what I think is happening is that above 35, there are many more abnormal embryos, and therefore, even if you are not doing well the biopsy, you're doing a positive effect, and you'll see improved results. Below 35, you have to be very good at doing the biopsies, and only the centers that have lots of experience doing PGT get good results.
This is kind of scary to think about, though, a biopsy of an embryo that you are emotionally so attached to growing into a live baby. Mm-hmm. You know, and now if we're learning that the technique for biopsy is really variable based on humans actually doing it, how would somebody go about selecting a lab or selecting a clinic that has really good technique?
Okay, so what I would do is to go into to the databases and look for clinics that do a lot of PGT. Okay. And then select the ones that have the highest pregnancy outcome. So for instance, it could be, I will look at egg donors, because in egg donors, those are basically all are fertile, and if you have good results in egg donors, then you will have good results in the rest of the population.
And this is SART.org?
Yes.
Okay, so SART.org is the website that you would go to look at these statistics of these labs in the clinics. Last question though about egg donors, should you PGT an egg donor?
It depends. So for instance, depends on the reason. Egg donors, depending on the center, you could have from 20% to 60% chromosomal abnormalities.
Wow.
And these obviously will have an impact on the results. The thing is that they produce a lot of eggs, and therefore you always find a normal one. But for instance, a gay couple that wants to do surrogacy, they would not like to get the pregnancy that's affected, because then they are not the ones that can terminate a pregnancy.
Right.
So most gay couples, for instance, use PGT in egg donors because of that reason, because then this situation is not going to happen. They are going to transfer a normal embryo.
Got it. So I think that these are the complicated decision-making points that all of our patients who need to pursue IVF face. And it's not cut or dry. You know, we call our field art for a reason. It's not just about the technology, it's about the sensitivity in how you stim someone and the sensitivity with which you do a biopsy. And we know these are difficult decisions to make. My recommendation is you find us on the Fertility Answers app. Santi is an expert on there. We have other experts in PGT, and you can ask any question on the Fertility Answers app platform. We're going to continue to check back in on Facebook Live throughout the next 3 days, bringing you a ton of great content. Thanks so much, and we'll see you in a few minutes.